Good evening, good afternoon, good morning, depending on where you're watching us from. You are welcome to Dr. Ephraim YouTube channel. This is a YouTube channel where we talk about the eye health. I remain Dr. Ephraim, an optometrist, a low vision specialist, medical director, Eye Free Vision Center, head of unit, optometry and low vision unit, Federal Teaching Hospital, Lokoja. You are welcome once again. Today we have come with an interesting topic that has to be there that will really help you when you listen very well. Today we are talking about the eye. We know that the eye is the window to our soul. But I want to tell you today that the eye is equally the window to your health. I want to talk about disease conditions that can manifest on the eye. That's systemic diseases that you can notice by merely looking at the eye. We are starting with number one that is common, that everybody will know whenever you look at the eye of a patient, which is what? Red eye. Red eye. Red eye is one of the conditions that bring patient into the clinic. Once the eye is red, guys, your eye is very red. What happened to your eye? That's what people will be asking you about. And then you will now come to the clinic for the doctor to assist you. There are red eyes that are normal. There are some red eyes that are very dangerous. We have two types of red eye. We have red eyes that are very painful, call them painful red eye, and then we have unpainful red eye. There are many causes of red eye. There are red eye that can come as a result of irritation, itching, some disease, some conditions outside. Maybe you climb the bike and dust enter the eye or something enter the eye, and because of itching the eye becomes red. But there are some red eye when you see it's give the doctor more concern. When there is an inflammation down to the uvea, there is what we call the uvea tract. It's called uveitis. Or when there is an inflammation of the sclera, which is called scleritis, which is the white part, then there is a tissue covering the sclera, which is called episclera. When there is inflammation of that episclera, it's called episcleritis. Some disease condition can come with red eye. For example, when you have what is called rheumatoid arthritis. Rheumatoid arthritis comes with red eye and some other eye complications. But when you see a red eye that persists for a very long time, it means that that patient has what is called rheumatoid arthritis. It can be juvenile rheumatoid arthritis. It can be sarcoidosis. It can be thyroid problem that brings redness of the eye. When you see all this redness, you know that it's a systemic condition that is causing it. Then another condition that you see in the eye that tells you about a disease condition is what we call yellowing of the eye. When you see a yellow eye or somebody's eye looking yellow and you see the skin looking yellow too, it shows that this patient has what is called jaundice. Jaundice is a common condition that nearly everybody knows about. When the eye is yellow, it shows that there is jaundice. And when there is jaundice, it shows that there is a problem with the liver. That means the liver, there is excess bilirubin in the body, and there is something going on in the liver. It might be cancer, it might be liver problem of any type. Then the next condition we'll talk about is what we call blurred vision. Blurred vision. When the patient walks into the clinic and the patient is telling her, doctor, I woke up this morning, suddenly I can't see very well. Once a patient is telling you that he cannot see, which we call it in eye care, sudden loss of vision. When there is sudden loss of vision or there is a blur, when there is a blur, there is a serious problem that the patient might have, systemic problem. For example, when the patient has what is called a migraine, especially there is a headache, the kind of headache that we call migraine headache. Most patients, when the headache becomes too much, they say, as doctor, I have migraine. No, there are some signs that you see this is migraine headache, especially when the patient can see blur, when there is blur. And then, or the patient is seeing what we call heat waves. You know what I mean by heat waves? When there is smoke that look like heat, the patient can see heat waves. Then there is what we call photopsia, when they are seeing flashes of light, scintillation. We said this patient has migraine headache. Then some other things that can cause blur again is when the patient has raised intracranial pressure. That's a cranial hypertension, or when there is cortical blindness. A lot of things can cause that cortical blindness. When there is tumor can cause blur. Then when it's meningitis, the patient can come up with blur too. So some of these conditions too can cause blur. You know that there is a systemic problem which is being manifest in the eye as blood. Then the pupil size. The size of the pupil tells us a lot about the systemic condition of a patient. Pupils generally react to light. There's what we call swing flashlight test. When you flash light on the eye of a patient, there is a reaction. For example, when you flash light, the pupil is supposed to constrict. Then when you start seeing a pupil dilating or a pupil constricting very sluggishly, you know that there is a neuronal problem. You have to do what? Refer that patient to a neurologist or check some other disease condition that can cause pupillary size. Then another problem is that when the pupil size are not the same, what we call anisocoria. Anisocoria means that the two pupils are not the same. There is a serious emergency when you see something like that. It becomes a problem. It becomes a neurological problem. So that patient needs to do what? Needs to be referred. That's why you see your doctors always do what? The flashlight on both eyes of the patient to ascertain the health of that patient. The pupil size tells us a lot about our systemic health because it's controlled by the autonomic nervous system. Then another condition that you see in the eye is called exophthalmos. Exophthalmos or Ptosis, that means the bulging of the eye. When the eye is bulging outwards, you notice that the patient's eyes are bulging outwards. First thing you suspect is what we call thyroid dysfunction. When there is a thyroid dysfunction, you see the eye bulging out, and then you notice redness at the upper part of the eyeball. When you notice this condition, then the patient normally have problem with gaze, and you see what we call diplopia. The patient complains of diplopia too, double vision. The double vision comes because the bulging of the eyeball comes because of the enlargement of what? The extraocular muscles. There's the muscle we call extraocular muscles. As you see in this dummy, these muscles that are cut off, they are called extraocular muscles. They are 6 in number. They move the eyeball in different directions. When they are affected by lymphatic infusion, when they affect the muscle becomes swollen. Swollen muscle affects the movement of the eye by making the eye difficult to move. When the eye is difficult to move, that patient will have a lot of friction because the eye is bulging out. So exophthalmos, Ptosis, and redness of the superior portion of the eye, the sclera, is example. It shows that the patient have what is called thyroid dysfunction. Then we have corneal arcus. Corneal arcus, they are whitish or yellowish ring around the cornea. When you look at the eyes of the patient, you see something that is white around this area. It's called corneal arcus. This corneal arcus can occur in two patients. You can see it in an elderly patient, or you can see it in a young patient. When you see corneal arcus in a young patient, it becomes a serious problem because it shows that that patient has problem with what? Cholesterol. There is high cholesterol level, or there is lipid problem. But when you see it in an elderly patient, it's not really a serious problem because most times when we are getting old, the blood vessels become more permeable to lipids. So you see the lipid deposit at the stroma of the patient. So with young patient that has arcus, we have to look at the lipid profile and then check the cholesterol level of that patient to be sure, because when the cholesterol level is high, the patient can suffer from stroke, can suffer from other problems. The cardiovascular problem too can come in. Then we have another condition of the eye that we call pinguocule. Pinguocule and pterygium. They are common growths that we see on the eye. You see it at the white portion of the eye growing towards the black eye. Some patients used to call it cataract, but it's not cataract. It's called pinguocule. And when it's triangular in shape and it's going towards the cornea, the black eye, we call it what? Pterygium. Pterygiums, they occur when you see them in the eye. It means that there is a sunlight effect. Sunlight is affecting the eye. There is a sunlight damage. That means the UV radiations is hitting that eye very bad. So that kind of condition, you use your sunshade to prevent the eye, or your photochromic lens to protect the eye from the UV radiation. That does not mean that the glasses will do what? We remove the pinguocular or the pterygium continuum to stop the progression, because it can affect the vision. When the pterygium grows into the cornea, it can induce what is called astigmatism and then block the pupil from seeing. We can call that blinding pterygium. So it now needs excision. So but with your sunshade or your photochromic lens, you can prevent the progression of that pterygium. Then another disease condition that we'll see in the eye that can tell you something about your systemic condition is what we call style. Style and chalazion. Styles and chalazions are called hodioleum. Hodioleums can be internal or external. Internal hodioleums are called chalazion, while external hodioleums are called styles. These are the boils that you see on the eyelid. Boils that come on the eyelid because of blockage of the ducts that secrete oil in the eye. There are glands in the eye. You have meibomian gland, you have Styes gland, you have plenty glands on the eyelid that secrete the oil that lubricates the eye. When they are blocked, or the eyelashes, or we call them cilia, when there is an infection that passes through the eyelashes, they normally call style. That's external hodioleum. Sometimes it's very painful. Then, how do you know that it's a disease condition? When these styles are recurring, when they occur at the same position of the eye, the same spot on the eye repeatedly, so you might be suspecting what is called sebaceous carcinoma. So with that, you have to examine that patient very well or refer for more thorough examination. Then we have what we call corneal ulcer. Ulcer, just as we know, is a wound. When there is wound on the eye, normally when you instill your antibiotics, that wound is supposed to heal permanently, or it will heal permanently. But when an ulcer becomes stubborn, that is the ulcer, as you are putting all the antibiotics, the ulcer refuses to heal. The first thing you suspect, if that patient is not diabetic, that means that patient might be immunocompromised. The person might be an HIV or AIDS patient. So you have to ask the patient to go and check his HIV status. Because if you don't take care of the HIV, that ulcer will blind that eye. Unless the patient is taking care, the HIV condition of the patient is taking care, that ulcer will refuse to go. So a ulcer that refuses to go for a very long time can tell you that this patient might be immunocompromised. Then another condition is what we call ptosis. Ptosis is drooping of the eyelid. People that when they are looking as if their eye is covered, most times they raise their head up for them to see. That is a kind of paralysis of the muscles that support the eyelid. When you see that kind of condition, we call it ptosis. Ptosis tells us a lot about the eyes of that patient. It shows that that patient has neurological problem. The first condition that is common that comes with ptosis, systemic condition, is what we call myasthenia gravis. Myasthenia gravis occur as a result of degeneration of the acetylcholine receptors in the eye, in the acetylcholine receptors in the body. When those receptors are affected, it affects the neurological condition of that patient. So that patient will have neurological problem. Most times it affects their respiratory muscles and their tracheal muscles. Respiration the patient will have a serious problem with respiration. Something that is called apnea too will occur. That means difficulty in breathing at night. So that kind of patient, you have to refer to a neurologist for more thorough examination. So with ptosis, you can see that this patient might be suffering from myasthenia gravis. Then there is a test we call ice block test, ice pack test. When you put ice block on that lid and you discover that the ptosis disappears somehow, it further confirms that that patient might be a patient suffering from myasthenia gravis. Then another condition that we'll talk about is when the patient is having pain on the eye, when the patient is moving the eye in different directions. That means rolling the eye northwards, eastwards, up in all the cardinal position, and the patient is having serious pain. It might be that this patient has what is called optic neuritis. And optic neuritis, as we know, is inflammation of the optic nerve. When the optic nerve is inflamed, because the optic nerve is this part of this nerve that is connected to the eye, and I've told you before that the eye is the offshoot of the brain. So when there's an optic neuritis, that means the patient comes up with pain on moving the eye, and there is blood. Sometimes they come with blood, and then you have the color vision sometimes is affected. When all these are put together, you might say that this patient has optic neuritis. And when there's optic neuritis, you don't rule out problem that comes from the brain too. There might be a need for the patient to do some thorough brain examination to be sure that there is no problem with the brain that is causing the problem on the optic nerve end. I know with all these conditions that I've mentioned, all these signs that you see in the eye that can help you to understand or they help you to suspect some systemic condition in the body, you'll be able to know when an eye is telling you that my body is not okay. So with all this, I know you must have learned a lot. If you have really enjoyed our content or this our short eye education, I will advise you to hit the subscribe button so that you can get more of this content whenever we post more. And also press the bell icon so that more videos will be posted. When more videos are posted, you'll be the first to watch them. Thank you.